Wouldn't you love to be able to give your patients much more protection with far less fluoride exposure? Now you can with the Enamelon Preventive Treatment Gel from Premier. Enamelon delivers twice as much fluoride uptake as demonstrated in standardized testing, FDA method number 40, and 3 times more reduction of enamel solubility than 5,000 parts per million fluoride toothpaste, as demonstrated in standardized testing, FDA method number 33, yet it contains just 970 parts per million of fluoride. That's over 80% less fluoride exposure. Enamelon Preventive Treatment Gel is made with a unique formula that delivers more fluoride uptake with less fluoride exposure, a huge benefit for all of your patients. The new standard of caring, Enamelon helps prevent caries and gingivitis and treats and prevents dentinal hypersensitivity. Enamelon Preventive Treatment Gel is the first daily use fluoride treatment to combine the protective properties of the stannous ion with the remineralizing potential of amorphous calcium phosphate, ACP technology. It is this remineralization that assists in the prevention of caries. Enamelon contains spillanthus, a natural herb that boosts salivary flow. This combination enhances the body's ability to form loosely bound calcium fluoride reservoirs, which provide a vital source of remineralizing ions in an acid challenge. In fact, in vitro testing shows that Enamelon decreases enamel solubility by 56.91%, providing 3 times greater protection against acid challenges than a 5,000 parts per million fluoride toothpaste. There are 2 ways that Enamelon Preventive Treatment Gel helps prevent gingivitis, a widespread problem that can progress to more serious periodontal disease. First, by preventing demineralization, Enamelon leaves the surface of the tooth harder, smoother, easier to clean, and therefore more resistant to the plaque accumulation that causes gingivitis. Second, Enamelon is made with stannous fluoride, which has been clinically demonstrated to reduce plaque more than sodium fluoride. Its patent-pending formula uses calcium and phosphate ions to uniquely deliver more of this stannous fluoride to the tooth. In head-to-head tests, Enamelon Preventive Treatment Gel was proven to provide more than twice as much enamel fluoride uptake as the 5,000 parts per million fluoride toothpaste, but with less than 1/5 the amount of fluoride. When compared to a 900 parts per million fluoride remineralizing paste, the results are even more striking. Enamelon provides over 32 times as much fluoride uptake with about the same amount of fluoride. Enamelon also treats and helps prevent problems with sensitivity. Dentinal hypersensitivity has been researched extensively, and one of the things that has been discovered is that it is frequently underreported by patients. By dispensing Enamelon Preventive Treatment Gel, you can provide your patients with relief from an often painful condition that they may not have even mentioned to you. Enamelon treats dentinal hypersensitivity by blocking the flow of fluids in the exposed tubules with a combination of stannous ions, fluoride, and amorphous calcium phosphate, ACP. Enamelon creates a physical barrier that covers open dentinal tubules and prevents external stimuli from causing pain or discomfort. These scanning electron micrograph images that compare the dentinal tubules after 2 applications of Enamelon versus after 10 applications of Enamelon illustrate how this occlusion works. Enamelon Preventive Treatment Gel is the only treatment that includes ultramulsion, a patented composition with unique properties. Ultramulsion provides a long-lasting coating that lubricates and soothes the soft tissues of the mouth. In addition, ultramulsion enhances the gel's substantivity, enabling it to continue its therapeutic activity for a prolonged period of time. The new standard of caring, Enamelon Preventive Treatment Gel, is safe and effective for daily use by patients of all ages, even young children. In fact, because it provides anti-caries, anti-sensitivity, and anti-gingivitis benefits, Enamelon is recommended for daily use by everyone, from those who require crown and bridge protection or who experience dental erosion, to oncology patients, ortho patients, polypharmacy patients, and more. Enamelon is gentle and non-abrasive and contains absolutely no sodium lauryl sulfate, gluten, or dyes. Plus, Enamelon tastes great, so compliance is typically quite high. Patients love its fresh, minty flavor. And when you choose to dispense Enamelon Preventive Treatment Gel to your patients, you eliminate the need for remineralizing pastes, prescription-strength toothpastes, and take-home rinses. Enamelon Preventive Treatment Gel is sold in convenient cases of 12. Each tube of Enamelon Gel comes with a 0.75-ounce tube of toothpaste. The Enamelon toothpaste contains 1,150 parts per million fluoride and a mild abrasive, and has more than twice as much fluoride protection as over-the-counter toothpastes. It's a well-known fact that teeth need the protection that fluoride provides. However, too much fluoride can be harmful for the rest of the body. Enamelon Preventive Treatment Gel contains less than 20% of the fluoride in the 5,000 parts per million pastes, but delivers more than twice as much fluoride uptake into the tooth and provides more than 3 times more reduction of enamel solubility. Safe and effective for patients of all ages, Enamelon gives your patients more protection with less exposure. It's the new standard of caring for preventing caries and gingivitis and preventing and treating dental hypersensitivity.